Hi, this is Scott Miller. Welcome to my Top Performance blog, and I have the pleasure today of being in Buffalo, New York, and working with Cindy Volker and John Catalino. John, you head up the CDOI project here at Spectrum, and Cindy, you're one of the vice presidents. Yeah, right? So, why CDOI?
Well, we started out about 3 years ago. Really started out talking about evidence-based practices, but then really like the concept of practice-based evidence, and sort of looking into some of the options and going to Scott's trainings, we decided that CDOI fit with a lot of our values and philosophy and gave us concrete data and ability to give instant feedback to our staff and clients as well, and so a lot of it seemed to fit, so we started on the journey.
Now, Spectrum is a fairly large group. How many people are we talking about? How many types of programs?
We have 8 different locations in Buffalo, across western New York. We serve about 5,000 to 6,000 people over the course of a year.
Wow.
We have almost close to 200 employees, so you know, we're a large community mental health center within this region.
And as you've done this implementation, and you're about the 3rd year into it, you've done the pilot, etc., what have been kind of the major or surprising challenges, roadblocks along the way?
I thought it's been nice for me as a line clinician, because we had already been doing a lot of client-centered stuff already.
Okay.
And this was such a great way to kind of formalize that or operationalize that client-centered piece of CDOI.
Okay, so asking for feedback, of course.
Getting feedback, privileging the client's voice.
Putting the
really
client in the center of the process.
Absolutely letting them drive.
That's great. And the challenges in implementation, anything that surprised you along the way?
Well, you know, I think that there was a lot of hesitancy to change with some of the supervisory staff.
Okay.
So I know I'd hoped that they would be a little bit more open and willing to explore new areas.
Okay.
And I think they're starting,
yeah.
But they seem to be a slower group to change, as opposed to like some of the newer staff.
Okay.
Who really have kind of latched onto this a little bit more.
Okay. And what has been helpful in the process of implementing? Helping with the supervisors, helping with any difficulties people encounter?
I think some of what really helped is that we started out with support from the top, from the executive level,
absolutely,
our board, from funders. We got a grant from our county to help us offset some of the initial training costs. We set up a transition oversight group to start planning the pilots. We trained all of our staff.
That's been helpful, actually?
Yes.
Okay.
We trained all of our staff, and then we rolled out the pilots, but I think it's taken longer than we thought. It's been more challenging to actually help people understand and wrap their head around what it is that you're really trying to accomplish